So I want to talk about what happens to patients when they become chronically ill, when they develop really serious medical problems that don't require just short-term hospitalizations, but much more care. So let's go ahead and start with the patient. And let's hypothetically assume that our patient has developed a really major medical problem, like she's had a really serious stroke. And let's go over the three possibilities for where she could go after developing the stroke. In the best case scenario, she would go to a hospital, and then in the hospital, her treatment would work really, really well, and she would fully recover. And so from the hospital, she could return back to her home. This is obviously the best case scenario. Most people really want to live out their lives at home and don't want to be in a hospital. So, and this is really the sort of the traditional way medical care is delivered. You go to the hospital, you get better, you go home, everything is sort of back to its usual state. And in terms of how the money flows here, your insurance, let's just say she's on Medicare, just pays for that inpatient hospitalization, and that's just sort of like the typical Medicare hospitalization. Now, let's say that she has a stroke and goes to a hospital, just as in the first scenario, and while the stroke is treated and she's somewhat better, she is still not ready to go home. She still is really not back to her usual state of health and needs really some help in the meantime. So that's what we're going to talk about here. She's not sick enough to stay in the hospital, and also, to be clear, Medicare pays the hospital, but they only pay a fixed amount of money. And that means that if she needs long sort of rehabilitation or extra care, then Medicare does not pay for that. And so she would then move to what's called a post-acute care facility, or I'll sort of abbreviate it as a PAC. And there's several kinds. There might be some places that are called inpatient rehabilitation facilities. So this would be staffed with people like physical therapists and others, and they really work with our patient to kind of teach her to walk again, to feed herself and bathe herself, in the hopes that over a period of time she could then be able to return home. Again, that would be really terrific. There are also what are called skilled nursing facilities. So this is where our patient just needs a little bit of extra time. Maybe she's had an operation, she needs some recovery. Again, hospital is not the best setting for her, but a skilled nursing facility where she gets intensive nursing support there might be really helpful. And those both ideally result in our patient then ultimately being able to return back home. I'm going to mention one other type of post-acute care, which is that a patient under certain conditions might be able to return home, but then needs some health care at home. And in those things, those are called home health agencies. So this is where nurses or other providers might come to your house to help take care of you. And this is also a form of post-acute care. And they would kind of assist you in getting back on your feet at home. Well, home health agencies, inpatient rehab facilities, and skilled nursing facilities, all, as I said, are considered part of post-acute care. And I'm going to talk about them in a little bit more detail. So we'll put post-acute care. So the first thing to keep in mind is that Medicare pays extra for each of these services. So whether you're in sort of this residential facility or you have home health that comes to your residence, Medicare pays for that. And that is an extra amount, an extra bundle of payment above and beyond what is paid for in the hospital. So post-acute care is an extra, I'm going to draw this in green, Medicare payment. And this all really led to a real explosion in the number of post-acute care facilities throughout the country, because Medicare, by changing how they pay for it, by giving just a fixed amount to the hospital, And then if somebody needed kind of this post-acute care, they had to go to a different facility, and only then would Medicare pay extra money. So this led to a real explosion if you look over time, and the number and the cost of post-acute care really starting in the 1980s, you really saw this sort of skyrocket upward. And today, if you look at how money flows in Medicare in total, Medicare's total budget per year is about 500 to 600 billion. And so I'll just write total. And on post-acute care, Medicare spends roughly $60 billion. So that is a lot of Medicare, which is really not spent in the hospital, but more in this kind of more kind of intensive non-hospital care of patients, where they're teaching them how to kind of recover, how to get better after an acute illness. And one way to understand why that's really become so important is to sort of look at a graph of, say, all Medicare hospitalizations. So I'll put Medicare hospitalizations and abbreviate that. Of all patients on Medicare end up in the hospital, what percent do you think go to get post-acute care? 1%, 10%, 20%? It's actually more than all that. It's about 40% of all Medicare patients, when they leave the hospital, end up going to a post-acute care facility. So that is one of the reasons why post-acute care has grown a tremendous amount, also driven by the sort of extra money that Medicare will spend on post-acute care facilities, has led to very high utilization of post-acute care. One of the other things to keep in mind, and this is going to come back to some of the cost issues, is to say that different states have very different spending on post-acute care. So let's say there's a state which is a low spender, and then we have a high spending, and I'll put state here, in Medicare spending. So let's just, and this is on per person basis on Medicare spending. It turns out that states that spend a low amount and the states that spend a lot of money on patients, if you look at that difference in spending between the low spenders and high spenders, a lot of that is explained by post-acute care spending being present in the higher states. As a result, because it turns out that many states have a huge amount of variability in how much they spend on post-acute care, many economists believe that post-acute care is the source of a lot of the waste in Medicare, meaning that some patients who end up going to post-acute care maybe don't need to go to that setting. Maybe they could go home more quickly. This is very controversial, but it's a big part of how people are discussing, can we reform Medicare to make post-acute care a little bit more economical and also keep it effective. One of the other things to keep in mind with post-acute care is that it is short-term. So let's talk about the third option of what could happen to our patient. Suppose she has a stroke, goes to a hospital, and treatment does not go so well, and our patient is left with very, very serious disabilities. She really has such major problems that she cannot even go to post-acute care, because ultimately we really do not expect she will go home. So she cannot go home. And so as a result, she needs to go to a long-term care facility. Long-term care. It's often abbreviated as LTC. And sort of the way to think about that, that's kind of like a nursing home. So the expectation is that our patient would really, it's not just something that's going to take a couple of weeks or months, it needs to take much longer. So this is not post-acute care, this is long-term care. So I'll just explain this is long-term and a very different situation than the post-acute care we just talked about. Now, there's one thing about long-term care which is really important, which is that if you're there for a long period of time, Medicare does not pay. Long-term care is not considered a routine medical expense. As a result, and it's hard to underemphasize this, it's important to emphasize this a lot. Medicare does not pay. So that means that if our patient here ends up going to long-term care, the money that's paid for that almost always comes out of pocket. And when we talk about out-of-pocket expenses, those expenses are huge. For example, in the greater Baltimore area, a year's cost of long-term care can easily exceed $80,000. You can imagine that in a few years that would completely wipe out the savings or any kind of economic security. This is a huge problem for a lot of people. So, in fact, that's what happens. I'm going to draw it in green here, is that most people end up really going bankrupt or losing all their money. We euphemistically refer to that as spending down. And then they're poor enough that they can then apply for Medicaid. That's really the system we have. And to this day now, about 2/3 of all long-term care is now paid by Medicaid. That means that most people, if you end up in a nursing home, end up going bankrupt. There have been many efforts to try and create a program to pay for long-term care ever since the 1980s, and then as a part of the Affordable Care Act or Obamacare that also tried to do it. The bottom line is that was felt to be so expensive that it was just taken out of the law. So as it stands now, if our patient here ends up in a nursing home and enters the long-term care system, those really will be considered out-of-pocket expenses. This is, again, a big problem because there are millions and millions of people that end up in this situation. No easy answers there.